Using the 30-second sit-to-stand test to assess functional mobility in individuals with obesity. Hello, in this video I'll be demonstrating the 30-second sit-to-stand test. The purpose of this test is to assess lower limb strength, muscular endurance, and functional ability. It's quick, inexpensive, and only really requires a stopwatch and a chair. This test is often used with the older adult population, patients with pulmonary diseases, bariatric patients, and other patients who have cardiovascular or multi-system impairments. In this video, I'll be demonstrating the role of a patient who is recovering from a bariatric surgery and present with lower extremity weakness, reduced endurance, and difficulty with mobility, like rising from the chair. I chose this outcome measure since the 30-second sit-to-stand test is shown to be both reliable and valid in the bariatric or obese population. In the study attached to this video, the test demonstrated that is highly reproductive of other outcome measures like the 6-minute walk test and grip strength, which is a very common and important outcome measure to use with the obese population. I have already explained the rules of the 30-second sit-to-stand test to the patient, including sitting in a standard chair with their feet flat on the ground and arms crossed over their chest to start, and then rising to a full position and sitting back down as quickly as possible, and trying to perform as many repetitions for 30 seconds. When performing this outcome measure, it may be appropriate to use a gait belt or guard to ensure safety. It is my job as the physical therapist to keep track of how many repetitions the patient is doing and also keep track of the time. I also want to assess with the patient and ask them how they are doing through the RPE scale. Having difficulty performing a sit-to-stand reflects that the patient might have lower extremity strength impairments or a functional endurance impairment. To correctly interpret a patient's results on the 30-second sit-to-stand test, you must take into account their age, gender, and amount of repetitions they completed successfully and correctly. In this example, our patient was only able to complete about 6 proper repetitions in the 30 seconds, so that would put him at risk for falling and indicate that he has lower extremity strength impairments and balance impairments. Deficits like impaired strength and impaired mobility cause decreased independence with daily life activities and often cause increased assistance for those daily life activities. It's also important to use extra safety and precautions when mobility training with these patients, like using a spotter and gait belt. So you want to make sure to use these precautions to decrease the risk of falling. You can also prescribe assistive devices like canes and walkers if you are looking to discharge this patient to ensure that they won't be at that high risk of falling. Based on the patient's performance in this test, we can target our goals accordingly based on his impairments like lower extremity strength and functional endurance. So one short-term goal for the patient is to increase the repetitions by at least 2 repetitions within the next 3 weeks on this 30-second sit-to-stand. One long-term goal for this patient is to achieve the norms of sit-to-stands within their age and sex. So for this patient in the example, he is a male and 75 years old, so she should be able to achieve at least 11 repetitions. Patient has a goal to achieve 11 repetitions on the 30-second sit-to-stand test in the time frame of 3 weeks. Some other appropriate interventions we could use with this patient include lower extremity strengthening exercises like sit-to-stands, squats, sit-ups. We could also work with endurance training like a walking program or doing like a cycling program, functional mobility practice like practicing transfers, and also want to educate this patient on energy conservation and just safe movement altogether. To ensure discharge is safe, I would want this patient to achieve his long-term goal of meeting the age-related norms for this test and also other tests like the 6-minute walk tests.